I, Tammy Clausen, consent to being a subject for a practice cardiopulmonary exam. The exam will be videotaped by the student who will be functioning as the examiner. The video will be submitted electronically to the course instructor at the University of Arkansas. Access to the video will be via Kaltura Media and Blackboard Learn and will be limited to the course instructors, teaching assistants, and program certification examiners. In the event of technical difficulties, access would be given to instructional designers and technical support staff as needed to resolve the issues.
Okay, we're going to do a cardiopulmonary exam today. First, I'm going to look at your breathing. Looks like you're in a relaxed position. No signs of unlabored breathing. No use of accessory muscles in the abdomen or the neck. So now I'm going to palpate the carotid arteries. Okay, 2 plus equal bilaterally. I didn't feel a thrill. I'm going to palpate your lymph nodes up here, so tell me if you feel any tenderness. Okay. No?
No.
Okay, no tenderness reported and no enlargements. So now I'm going to sit you up just a little bit. Okay. We're going to percuss now, do some percussion. Okay, I have to lift this up and get underneath the gown. Now sit up just a little bit and turn to the side so the camera can see. Okay, you can lay back. While I was percussing, I noticed that the anterior and posterior diameter is about the half of the length of the transverse diameter. So that is good. Now we're going to auscultate your breath sounds. Here one more time. Okay. I'm going to turn around again for me. Okay. Lungs sounded clear, no adventitious sounds like crackles or wheezing heard. Now you can lay back. Well, I got you at a 35-degree angle. I'm going to check for jugular vein distension. So just lean your head that way. Okay, look towards me. Okay. I don't see any signs of distension. The neck veins are flat. So now I'm going to lay you flat on your back. inspect the skin. Seems to be pink and tannish, appropriate for race. Let's see. Looks intact. I don't see any signs of cyanosis, pallor, erythema, or jaundice. Seems hair evenly distributed. Seems to be shaved. Now I'm going to do some palpation on your chest. You're just feeling for thrills. Okay, I'm going to raise this up. I don't feel any thrills. Now I'm going to palpate for the apical impulse, which should be around the 4th or 5th intercostal space, midline to the midclavicular line. Yours is at the 4th intercostal space and seems to be short in duration. Okay. Now I'm going to feel all your pulses, so we'll start with the radial pulses and check each side. 2 plus equal bilaterally. Check brachial. 2 plus equal bilaterally. I'm going to check your dorsalis pedal pulse. 2 plus equal bilaterally. Check your posterior tibial pulses. 2 plus equal bilaterally. Now I'm going to check your popliteal pulse. I'm going to pull this up one at a time. Okay. Two plus equal bilaterally. Now we are going to feel the femoral pulses. 2 plus equal bilaterally. Do you notice any tenderness in the inguinal groin areas?
No, I do not.
Okay. So now we are going to auscultate some heart sounds. We're going to listen with the bell and the diaphragm of the stethoscope. We're going to start with the aortic, which is in the 2nd intercostal space on the right side of the chest. Switch and listen with the bell. Okay. We're going to move to the 1st pulmonic, which is at the 2nd intercostal space on the left side of the chest. Okay. Now we're going to listen to the 2nd pulmonic, which is also called Erb's point, at the 3rd intercostal space on the left side. I'm going to listen with the bell. We're going to lift this up, listen to the tricuspid, which is at the base of the sternum. Okay. Last one is the mitral, which is at the 5th intercostal space. Heart sounds appear to be normal throughout. I did not hear any S3 or S4 gallops, no murmurs noted, and S2 was louder at the base, at the apex, and S1 is louder at the base. Okay, so we're going to listen to this trigger. Look at the rubric and see if we missed anything. Okay, we did not check cap refill, so I will do that now. Refill is less than 3 seconds and instantaneous. Do you have any questions?
No, I do not.
Okay, that's the end of our assessment.